I'm going to go through this pretty quickly because we're running out of class time. But hi, my name is David Lam. Today I'm doing the topic on physician-assisted suicide. It should not be legalized in the U.S. My main claim and my secondary claim will be physicians using assisted suicide would be helping and encouraging a person to end one's problem through limited options. And my second claim will be physician-assisted suicide would be devaluing human lives. According to Ryan Anderson, a senior researcher in American politics and principles, PSA, short for physician-assisted suicide, would be endangering the weak and vulnerable. The job of a physician is supposed to be helping deal with patients, their mental health and their physical health, deal with their pains and stuff. PAS does the opposite of healing patients. It does not go in line with the healing goals of medication and physicianal help. People in those situations are dealt with hardships and usually felt as if they're alone and have no one to cope with. They're faced with poor care and dealing with unrecognized psychological help. For example, those who are seeking other options have an easier option to just either kill themselves or to suffer. PAS changes the views on doctors. When a patient knows that a doctor is doing this type of study, it might deteriorate their views on them because it might show that doctors are not capable of helping a patient instead of just giving them the option of suicide. Those who do not have access to different forms of help maybe see this as the only option. For example, elderly people might feel like they're a burden to families and might see that this is an option to go help with. According to the Department of Medicine in Oregon Health Sciences, the university, 46% of those who took a questionnaire responded to possibly taking this as an option if it was legal. It can also be abused. People who are in this situation are pressurized to use PAS. For example, in the Netherlands, during the 1990s to the 1995, studies and statistics show that 0.7% of cases had lives ended without the explicit what do you call it? Explicit coherence request of the patient. Legalizing PAS would be a violation of natural rights. It would be enabling suicidal desires. Those who are seeking PAS are limited to those who are limited to PAS are inclined to end their lives and go to doctors who offer PAS. And in an Oregon case, a girl named Helen, a woman in her mid-80s, had breast cancer and went to two PAS doctors who would decline her because they thought of her having mental problems. And the first two who declined led her to a third doctor, which helped her kill herself. Thank you.
All right, well, the proposition's identified, but it's phrased as a policy proposition, so that's a little bit problematic. And then you have two secondary claims which you actually label as separate propositions, and that kind of goes in different tangents. One of them is potentially a claim of fact. The other one is almost a claim of value, although there are some factual issues concerning it. The secondary points, though, they're not really, structured very clearly, and once you get going on this, it feels sort of like you're roaming randomly from topic to topic. You need a stronger sense of what the point is. I think your argument comes down to, let me give you the simple version of it. Allowing physician-assisted suicide would have substantial harmful consequences. The first harmful consequence is that it would make suicide an acceptable option for people in healthcare, and the second is that it would result in people being maneuvered into choosing suicide as an option rather than following what would be an appropriate pattern of treatment. And I think that if you structured those claims that way, this argument would be a lot clearer. You're dependent on some hypothetical examples to prove your point. You have your last example, for instance, you mentioned this woman Helen, and I'm going, okay, wait, what happened? It was not quite clear what it is that occurred. It sounds to me like what you're saying is doctors who accept PAS decided that they wouldn't treat this woman because she's 80 years old, and then they sent her to somebody who does use PAS as a way to eliminate this problem. I'm completely confused as to how that fits into your argument, either suggesting that people are being manipulated or suggesting that people will see it as being acceptable. The Netherlands information, I think, is useful information, but it does need to be presented a little bit more effectively, and we need a source citation on that. The Oregon data, the fact that a number of people said that they would consider doing this, I guess that's a link to your first point that suggests that people might see it as being an acceptable alternative. And I think there ought to be a consequence about why that is, in fact, a problem there. The quote that you have kind of at the start of your speech from Ryan Anderson that says it's going to result in the exploitation of the weak and the vulnerable, I think that that's ultimately the point that you want to keep coming back to, that people who might find this as being a potential solution to their problem have difficulties, that this is not really a solution to their difficulties, and that it will be used as a way to kind of get them off stage so that we don't have to deal with their difficulties. That's sort of the way this argument ultimately needs to develop a bit. All right, I'm going to stop there. Thank you.